Auzubillahi minash-shaytanir-rajim. Bismillahir-Rahmanir-Rahim. Welcome everyone. First of all, I'm really sorry that I could not attend a few of the sessions this week and because of Corona. Alhamdulillah, now I'm fine. So everything will go on smoothly, inshallah. Today's lecture is actually a most important lecture for your case history pattern. The case history, as we all have discussed earlier, is the important point for the diagnosis as well as the treatment planning of a particular patient's disease. Okay, so we will see what all things are covered in this, how we do this, what are the steps to be followed, other things. What are the learning objectives of this lecture is to understand what information should be elicited in the history taking, what all you should extract from the patient, how to develop a questioning style that is consistent through and obtains the most information from the patient. The diagnosis basically involves three major steps. When you want to diagnose a disease, there are three major steps involved in it. The first one is the history, the second one is the examination, and the third one and the final will be diagnostic test and the diagnosis. Today we will be dealing with the history part. Examination will include extraoral and intraoral examinations, even the general physical examination. Then diagnostic test, there are various tests which will lead you or which will help you for the final diagnosis. Now, case history. What is case history? Case history is professional conversation. It is a professional conversation with the patient to obtain the nature of his illness, to know the problem of the patient. This is professional conversation with the patient to know his problem. Evaluation of the patient prior to the dental treatment. This is again a very important part. You have to evaluate your patient before doing the dental treatment. Okay, evaluate in the sense whether your patient is fit for the dental treatment or not, or is there any medical problem which can disturb or interfere in your dental problem, dental treatment. So you are supposed to know these things before you start your dental treatment. To achieve that, we take a proper case history. So remember, case history is a professional conversation with the patient to know his problem, evaluation of the patient prior to dental treatment. Now, why we take a case history? To arrive at a tentative or a probable diagnosis for the patient's complaint. Okay, you want to achieve a diagnosis for the patient's complaint. Second, to determine whether the patient has any systemic problem that might affect the diagnosis. To determine any systemic condition that the patient has which will require certain precautions during the dental procedures. Is it clear till now? Everyone following me? Any doubts, you can ask me in between. Okay, anywhere in between, if you have any doubt, please ask me. Okay, in case history, these are the two terms which we will be using very frequently, and maybe these terms are new to you, so we will explain this before we go into it. Sine and symptom. What do you mean by sign? This is sign. Okay, sign is evidence of disease which is visible to a trained observer. Now here It is something related to disease which is visible to a trained observer. Trained observer, it could be a doctor, it could be a nurse, anyone who knows medicine, who knows dentistry, who is educated, who has an idea about this disease. Okay, remember, sign. Sign is an evidence of disease which is visible to other trained observer. For example, appearance, it could be appearance or it could be something else. For example, tenderness. Whether anyone has any idea about tenderness? Anyone in the class? Do you know what is the meaning of tenderness? Pain. Okay, but what pain? What is the difference in pain and tenderness? Okay, let me explain you. Pain is a general pain which is felt by the patient. Okay, tenderness is something when you touch, the patient feels pain. If you don't touch, there is no pain. So, such things we call it as tender. So, this tenderness is a sign, and pain is a symptom. I'll tell you about the symptom now. Symptom, it is evidence of the disease felt by the patient. Now, patient says he has pain, but as a doctor, you cannot feel the pain. You rely completely on the patient. If patient says pain, yes, it is pain. Hope you all are getting me. This is the thing only felt by the patient. Pain. Are you getting me? Is everyone following me? So now, did you understand the difference between tender and pain? Tender is normally there is no pain, but when you touch, there is pain. So that is tender. That is sign of a disease. Whereas pain is a symptom after touch. Yes, Mohammed, after touch. That is tender. Okay. Now, when you take a case history, the general considerations are that you have to remember few things. Question should be open-ended. What do you mean by open-ended? Is never give a clue about any answer to the question asked by you. Let the question be open. Don't ask any question which will give you an answer as yes or no. Okay? Let the patient explain you whatever problem he has openly without any clue from your side. Don't give any leading questions. The question should be clear and should touch various aspects of the disease. This is okay for the initial part. Ask which questions. Yes, Abdulillah. Here in case history, you will be asking different questions. When, as and when I go through the lecture, you will come to know when I give you one example of a patient. For example, I'll start here itself. If a patient has pain, okay, his chief complaint is pain. Now you want to know what type of pain it is. Yes, why, how, what? Exactly, Abdulillah, exactly. These are the questions which you are going to ask. Yes, yes. So in these questions, don't give a clue. You cannot ask him whether the pain is sharp. No. So that is an open-ended questions. You are getting me, Abdulillah? Never give a clue about the answer for your questions. Let the question be open. Ask the patient, tell me how do you feel about your pain? Explain your pain. Okay? So that will give the patient more options to explain. Yes, Abdullah, you are correct. You are correct. Okay? We will have an example after a few slides, inshallah. Definitely, if you have a patient who is under 5 years of age, the parents will be interviewed. For example, you will ask the parent, since how long your kid has a problem? what is the actual problem, whether he gets up in the night, during night he has any problem, he has any problem during eating the food, or anything, whatever questions related to the patient, you can ask the patient's parent. Okay, that is under 5 years of age. Symptoms described by patient should be recorded in his own words. This is very important. I'll tell you again, when we say chief complaint, it should always be recorded in patient's own word. I'll come to it. And what is the role of a doctor during case presentation, or sorry, the case history? He should be a attentive listener. Just listen to what patient is telling. Let him explain his problem and note it down in your case sheet. Now, as we discussed, case, uh, is everyone here now? How many are there? Now 11, 10 students, right? Okay, fine. So what are the three parts we discussed about case history? Three main parts which are there in case history. One is history. Second, examination. Third, investigation and diagnosis, right? Okay, so we are talking about the history, the first part. It basically includes three main stages. The first one, a brief introduction, introductory phase, which will involve your introduction as well as the patient's introduction. Second, listening to patient's problem. And third, forming a questions related to patient's problem. Now coming to the first introductory phase, greet the patient by name. And this is very important. Always remember, I follow this even in my clinical sessions, not only for the patients, for the students also. I feel calling them by their name, it makes little comfortable for the patient. Okay, remember, greet the patient by name. Introduce yourself by name to the patient, and always use plain speech. Hope you understand what I mean by plain speech. There are different types of speech, there are different type of essence, so always see to it whatever you say is clear to the patient. Of course, Abdullah, very good. Now name, why I should know the name of the patient, right? It's very important for communication. As I told you, patient is very comfortable when you call him by his name rather than calling Mr. Oh, hello, all other things. It's better to call the patient by his name. And if he is elder to you, of course, with respect, you call him as Baba, or in female they call Ummi, Kha, whatever it is. Okay? So it's all due respect. Name is very important for communication. It is important to establish a harmony with the patient. Of course, it's important for maintenance of your records. Now, this is the first chart which opens up in your case history paper. If you go back to your logbook and check, these are the things. Dates, of course, the date is mentioned on the top of it. Then there is something called as file number. This file number should be entered here, which will be easy for you to open up a file when he comes up for the checkup next time. Okay. Then comes the name, patient's name. Okay. Now the next. Now the gender. Why we should know whether your patient is a male or a female patient. Of course, as we have discussed last week also, there are certain diseases which are common in certain gender. Okay. So we should know the gender of the patients. For example, females. Females have more common temporomandibular disorders, Sjogren's syndrome, lichen planus. All these are just few listed example which are very common in females. Whereas attrition of teeth, active caries, yes, oral carcinoma, all these are very common in male. Now let me make one thing very clear here. Very common doesn't mean that it is not seen in other gender. Please remember this. It can be seen in both male and female, but it is more common in certain gender. Hope I am clear. Very common doesn't mean it is not seen in other gender. Okay, fine. And before going into the further slides, let me make it clear. Every information what you take in case history is directly or indirectly related to diagnosis and treatment planning. Everything, whatever you do in case history is directly or indirectly related to diagnosis and treatment planning. So you know gender, how it is related to the diagnosis here. Of course, when we say gender, female patients may have pregnancy issues also. Okay, and then pregnancy related diseases and other things, those are common in females. Now coming to the age, why we should know the age of the patient. Of course, the treatment planning is different for different age group. For example, there might be a mobile tooth, okay, mobile tooth in a patient with 6 years of age. Upper central incisor is mobile. There is one more patient who is 27-year-old and his upper central incisor is mobile. Now, can anyone tell me what is the difference in these two mobility? A patient age 6 years and a patient age 28 years. Both the patient complains of same thing. Upper front tooth is mobile. Can anyone tell me what is the difference? Physiological in the young age. MashaAllah. MashaAllah. Very good. Very good. Both are correct. Ali Khabi is also correct and the other Ali is also correct. The mobility which is seen in case of a 6-year-old boy is a physiological mobility. Okay. So you don't need any treatment. It is a normal process because of a erupting permanent tooth. Whereas a 28-year-old, maybe he's having a periodontal problem. So he might require some treatment. So you understand how the treatment plan is changing according to the age of the patient, though the complaint is same. Is it clear? Okay. Now coming to the behavior management technique. You all know that it's little difficult to manage small kids during the treatment. They just hesitate to take the injections. They don't sit properly in the dental chairs. So you need a different approach for them, which will be taught to you in pedodontics. One of them is something like tell, show, do technique. Okay. You have to tell them what you are doing, then show them what you are going to do, then do it. Okay. So these differs according to the age of the patient. Of course, when you give a drug, a medicine, the dosage is different for small kids and it is different for adult patients. So here comes the importance of age. There is another important part related to age. There is certain diseases which are very common at certain ages. Like children will have cherubism, adults will have periodontitis and pulp stones, and most patients with oral carcinoma are above 40 years of age. Now, why does the address is important in a patient? Of course, for future communication, difficulty in attending the appointment. This is a very important thing here in Jazan. So always remember, whenever you give an appointment, Remember the address from where the patient is coming. If he's coming from a far distance away, try to do the treatment on the same day. Don't call him again and again for many appointments. If a person is from a local area, from Jazan itself, you can call him again tomorrow. But a person who is coming from Samtha or any other place, it's better to do the treatment on the same day. Okay, fine. Address is also important in case of certain fluoridation of local water. Certain areas, they provide fluoride with the drinking water, so which can help you in diagnosis of fluorosis. Telephone number, of course, for communication, you need telephone number of a patient. Occupation, you should know the educational status of the patient as well as the socioeconomical status so that you can give the proper treatment planning to the patient. There are various options in dental treatment. Certain options are cheaper when it comes to money, and certain options are little costlier. So it depends the socioeconomic status of the patient. You can advise him accordingly. Of course, there are certain diseases which are seen more commonly in certain professions, such as this tailors. I don't know what you call them as. Tailors, they have abrasion of front teeth because they have this habit of keeping a needle in between the teeth. Okay, and see these guys, they are exposed to sunlight throughout the day. They are working on the field, they are exposed to this field, and they can cause ulcers of the exposed area. Fine, that was regarding your occupation. Now coming to the main important part, the chief complaint. Always remember, this is the most important part. Chief complaint is the reason why patient is in front of you. Chief complaint is the reason why patient is visiting you, why patient is needing your help. That is chief complaint. Most important. Always use an open-ended question. For example, how can I help you? As I told you, chief complaint is the most important or utmost priority in case history. This is the most important part. Record the complaint in patient's own word. Now, what does this mean? Can anyone tell me? Patient's chief complaint should be recorded in patient's own word. Anyone? Quote them literally. Okay, fine. For example, Ali, for example, if patient comes and tell me that I want to remove my tooth, so what do you write in the chief complaint, Ali? You will write it as patient wants to remove his teeth? No. Here you have to ask the patient why you want to remove the tooth. Yes, yes, Abdullah. This is for Ali. Ali, remember, when patient comes to me and says that I want to remove my tooth, you have to ask him why you want to remove your tooth. You cannot just write, okay, patient told me, so I'll just write, patient want to remove his tooth. No, you have to ask him why you want to remove his teeth. Then the patient might say, no, I have problem in this tooth, I have pain in this tooth, so please remove it. Then your chief complaint will be patient complains of pain in this tooth and he wants to remove it. That will make a complete sentence. But if you just write, I want to remove my tooth, you cannot remove a tooth just like that. You have to ask him why he wants to remove a tooth. Okay? So remember, if I say it should be in patient's own word, don't write exactly what patient tells you. It should make some sense when you write it. What I mean by patient own word is here you cannot use terms like maxilla, mandible, anterior, posterior. These terms we cannot use here. Okay. Otherwise, whatever patient says, for example, patient comes and tells you that he has pain in this side. He will never tell you upper jaw, lower jaw, right or back. He will just point a finger. So in those cases, you cannot just write patient complaints of pain in this area. No. Now you have to see which area he's showing and then write it down that area in the patient's own word. Hope I'm clear to everyone. Yeah, I'll come to it, Ali Kabi, I'll come to it. I'll come to it. Okay, fine. Alhamdulillah. Alhamdulillah. Okay, now this last point, record symptoms in order of appearance and severity. Sometimes what happens, there are certain patients like Ali Kabi. Ali Kabi troubles me a lot during the sessions. You know, he's my troubling guy. He's always been behind me. He asks most of the questions to me. So Ali Kabi comes to me and says, Doctor, I have pain. Doctor, I have swelling. Doctor, I have this, I have that. So there are almost 10 problems with Ali Kabi. You know how is Ali Kabi, right? Always troubles me in the clinic. Don't laugh, Ali. You troubles me a lot. Fine. Now for those patients, how do you write the chief complaint? Stop laughing. It's over. It's over. Joke is over. Okay. Now, if you get a patient like that, so what you have to do is now you have to ask Ali Kabi which is the symptom which occurred first. Was it pain which came first, or was it swelling which came first? You all are getting me? What I mean by record symptoms in order of appearance and severity. It should be recorded whichever comes first. Yes. Then next, then next, then next. Patient might have 10 problems. It's okay. We don't have any problem with that. But when you record it, it should be recorded either in the form of severity or in the form how it appeared. Problem which appeared first will come first. Is it clear for everyone now? Okay, okay. Yeah, Ali Kabi, I'm just joking, huh? You're the best guy. Don't worry, you're the best guy. I'm just taking your name because you don't mind whatever I say. If patient doesn't remember, forget ya Abdulillah. Even I don't remember. Forget. No problem. Don't worry about it. You can simply write in the case history that patient does not remember which came first and which came last. No problem in that, Abdulillah. Okay? You can write that. But asking him is compulsory. You should ask him. Fine. Now, when you go to the next page, in that next page, you have this page. Okay, there is something like a type of visit, whether this is an emergency visit, patient came for emergency, or it's an admission case. This is the area where you write the chief complaint. Okay, whatever patient complains, you are supposed to write it here. Then there is history of present illness, medical history, and all those things. We will say this. We'll see this. Now coming to the second part. See this part. We have finished history, chief complaint. Now we are going with history of present illness. We will see what is this history of present illness. Now, what do we mean by history of present illness? History of present illness is it is a chronological account of development of the problem. How did the problem develop, or how did the problem start? All these details will be mentioned here in history of present illness. Now here you are supposed to ask more questions. Okay. Now the questions will be related to the chief complaint. Remember here it is history of present illness. Present illness in the sense about the problem what he is facing right now, the chief complaint. Number one, onset. For example, Ali Kabi complains of pain, right? Now, my question in this part will be how did the start? How did the pain start? Was it sudden or gradual? Right? Now, what is the difference in sudden and gradual? Can anyone tell me with an example? You can use your mic if you want. If not, you can type. What do you mean by these two words, sudden and gradual? Sudden like crash, okay, and gradual like increasing slowly. Mashallah, good answer. Short period of time, okay, very good, very good. Sudden, like you can see in this picture. Now this man is about to strap on these pin. So now the pain he feels after this will be a sudden onset of pain or gradual onset of pain. Sudden, of course. Okay, like if a person is going into the car and there is a accident and he has trauma and he has pain, so definitely it is a sudden onset. Gradual onset, something very chronic with a long duration of time, or sometimes more usually what happens is patient comes and tell you, Ali comes and tell me, doctor, yesterday I was eating laham and suddenly the pain started. So that is sudden onset. Hope you all are getting me the difference between sudden and gradual onset. Yes, yes. Next, duration. Okay, before going to the duration, when you write the chief complaint, I'll go back to chief complaint once again. Okay, when you write a chief complaint, always also try to write the location there. As I've already mentioned in the clinical session, the three things which are very important when you mention a location is you should write whether the pain is in the upper or lower jaw, whether the pain is felt on the right or the left side, and whether the pain is front or back side of the jaw. Hope you're getting me. You should write about the pain or any other complaint, whether it is felt in the upper or lower jaw, whether it is on right or the left side, and whether it is in the front or the back side of the jaw. Is it clear? Yes. Yes. No maxilla, no mandible, no anterior, no posterior. Alhamdulillah, Muhammad. Alhamdulillah. Now, coming to the next part, which you will ask in history of present illness, is duration. Now, duration is like the time, how long the pain persists. Okay, when I say about duration, there are two things about duration. Remember here. Duration number one, since when you have this pain, this is one type of duration. Like Ali says, I have this pain since last 1 week. So this 1 week is the duration. Fine. The next is if the pain starts, for how long the pain remains. Ali told me today morning when I was eating the food, the pain started, and when I finished my food, there was no pain. So maybe 2 minutes. So that is another duration. You're getting me? There are two types of duration. The first duration is since how many days he is having this problem. The next, when this problem starts, for how long it stays. So you have to mention these both the things in history of present illness. Is it clear to everyone? Okay. Yes, yes, Abdullah. Duration, we have two types of duration. Now remember, we are into history of present illness. We are inquiring about the patient's chief complaint. Now we have taken pain as a chief complaint, and we are asking him about the pain. The first thing we asked him about was whether it is sudden onset or gradual onset. The patient will answer you. Next, you will ask about the duration, since how many days he is having this problem. Okay, the patients may tell since 1 week, sometimes patient may tell 1 month, 2 month. So this 2 month will be your duration. The second type of duration is you are also supposed to ask if the pain start, For how long does it persist? For how long does it remain? Okay, it will help you in giving you a diagnosis for acute or chronic cases. For example, as I told you, Ali tells you that today morning when I was brushing my teeth, the pain started. But when I stopped brushing, the pain went off. So maybe 2 minutes or 3 minutes. That is again one more duration. So you have to record both the things. Is it okay? Now, based on this, he can have short duration pain or a long duration pain, that is intermittent pain or continuous pain. There is something called as recurrent pain. Sometimes the pain goes and comes back again, goes and comes back again. So we call it as recurrent pain. Two or more similar episodes of pain, we call it as recurrent pain. Periodic pain. It is regular recurring episodes, regularly occurring at particular time or particular uh, type of, always whenever I feel, always whenever I chew my food, I have pain. Always whenever I do this, I have this pain. Okay. Okay, as I told you about the duration, one more thing. Since how many days patient has this problem? Okay. So remember duration. When we talk about duration, there are two main types of duration. The number one will be since how many days he is having this problem, and next duration will be for how long he has this problem. Next, there is something called as aggravating factor. When I say aggravating factor, it means something which increases the patient's problem. Now, I took an example of Ali Kabi. He came to me with a complaint of pain. So when I ask him, does anything increases the pain? Ali Kabi will tell me, yes, doctor, when I am standing in front of you, the pain increases. He is very naughty, Ali Kabi. He tells me, whenever I stand in front of you, the pain increases. Or, doctor, whenever I attend your lecture, the pain increases. It happens. It happens. Right, Ali? Yes, yes. So for Ali, Dr. Najmuddin will be an aggravating factor. Listening to Dr. Najmuddin's lecture, the pain increases. Aggravating factor. Fine. Ali has written a correct answer. While eating food, okay? Sometimes the patient says that, doctor, whenever I eat food, the pain increases. Sometimes patient says, whenever I go to bed, the pain increases. So all these things will come under aggravating factors. We call them as aggravating factors, factors which are increasing the pain. The next is a totally opposite of that, relieving factor, something which relieves the pain, something which relieves the pain. For example, it could be some medicine, analgesic, or simply when you sleep or something. Patient says, when I sleep, I don't have pain. When I take rest, I don't have pain. Doctor, when I take Panadol, there is no pain. So all these are relieving factors. So try to remember aggravating factors and relieving factors. Okay, now these symptoms, they might require further elaboration. What do you mean by further elaboration? I'll show in the next slide. Okay, what are these things which we elaborate further? For example, we have taken, this is HOPI, is history of present illness. Okay, history of present illness for pain. Okay, there is a patient complains of pain. Now you have asked him about the onset. Patient will tell you whether it is sudden onset, yes, affecting after a period of time, or insidious onset, or gradual onset. Duration, time since the onset. Of course, as I've told you, when did the pain start from there till now? Okay, how much time since the onset? Location, always remember when I say a location, it could be diffuse. What does it mean by diffuse? The patient cannot pinpoint a particular area where he feels the pain. He will just show you one side and he says, I have pain here. I don't know which tooth. Such type of pain, we call it as diffuse pain. Is it clear? Okay. Next one, localized. Of course, when I say localized, it is very clear. Patient will pinpoint at a particular tooth and tell you that I have pain in this tooth. So this is localized to that particular area. Pain could be diffused or localized, or it could be referred pain. When I say referred pain, patient may tell that the pain is radiating from tooth to my ear. This is called as radiating pain. Radiating pain. Now coming to the type of pain, the quality of pain. Is it severe? Is it mild? Or what it is? There are different types of pain. For example, throbbing pain or dull pain, sharp pain, lingering pain. Remember, these type of pain will also help you in diagnosis. How does it help? Remember, usually acute cases, acute condition will have severe pain, whereas chronic cases will have less severe pain. Here, when I say dull and throbbing pain, this will most probably indicate an acute condition or a chronic condition. Can anyone answer? Throbbing pain or dull pain mostly indicates chronic. Okay, one guy says chronic. Anyone else? Acute by Muhammad. Anyone else? Chronic, chronic. Okay. Mostly it indicates chronic pain, dull pain. Yes. Okay. Sharp or the lingering pain usually indicates a acute condition. Intensity, of course, you are supposed to ask whether the pain what is felt by the patient is mild, it is moderate, or it is severe. Frequency, whether the pain is constant, from morning till the evening, the pain is constant, or it is intermittent. Yes, yes, ma'am. And occasionally, sometimes the pain could be occasionally. Aggravating factors, as I told you, biting something, as shown in the picture, biting an apple aggravates the pain. So you can call it as biting is an aggravating factor. Sometimes a caries patient may tell you that eating sweet increases the pain. So the sweet will be a aggravating factor. Eating cold, hot, any of these things will be included in the aggravating factor. Relieving factor, as I've told, anything which relieves the pain, we call it as a relieving factor. Now, this is one of the example. Okay. Patient complains of pain in the lower right back tooth for the past 1 week. Can anyone tell me what does it mean? Lower right back tooth, which quadrant it is? Quadrant number 1, 2, 3, 4. Ali says 4, 4, 4, 4. MashaAllah, all are correct. All are correct. Okay. So if a patient shows you that he has pain in quadrant number 4, then this is the perfect way of writing it. Patient complains of pain in the lower right back tooth. Okay. For the past 1 week. So now this past 1 week is what? What is it? What do you mean by this 1 week? What is this 1 week? Duration, mashallah, mashallah. Good, good. Now next, it was sudden in onset. Okay. Pain is localized and throbbing in nature. Patient reports that the severity of pain increased on consuming food. Now here consuming food is what? Aggressive. Okay, aggravating. Okay, aggravating factors. Fine. And relieves on taking medication. So of course medication will be a relieving factors. Now here, because the patient told that when I take medicine the pain gets relieved. Now you are supposed to ask which medicine. Okay, sometimes patient doesn't know the name of medicine. Then you can write the nature of medication taken is not known. We don't know what medication he has taken, but on taking medication the pain relieves. Is it okay? If the patient tells you Panadol, you can write after taking Panadol patient gets reliefs. Is it okay for everyone? Okay. Now this is one more example that was in relation to the pain, and this scenario is related to swelling. Now here location, can anyone tell me how do you write location here? The patient complains of swelling under the tongue. Okay, how do you write the location for this swelling? Can anyone tell me? Anyone just tell me the location? Lower left back, floor of the mouth. Okay, anyone else? Under the tongue will be the most appropriate thing for this. Floor of the mouth is could be taken as again a dental term, because the patient may not say floor of the mouth. He may say below the tongue or under the tongue. Hope you are getting me. In the chief complaint, you can write under the tongue or below the tongue. Fine. For you and me, when we are discussing a case, you can tell me it is in the floor of the mouth. That is okay. When it is a professional term with you and me, it's okay. But when you write a chief complaint for the patient own words, you should use something which is very simple. Okay, fine. Duration. Anyone? Just tell me something. Duration. What could be here? Duration. What I should write here in duration? Anyone? 3 days. Okay, accepted. Muhammad says 3 days. Fine. Now mode of onset. How did it start? Swelling increased just before eating. What is the patient saying? Swelling increased just before eating. This is a very important point when you discuss. This is basically because of salivary stimulation just before eating. Okay? Remember how does these things help you in diagnosis. Our patient says no, it is slow growing. It is slowly increasing in size. So it could be a chronic infection or it could be a benign lesion. Yes, yes, Abdullah. Or the patient says, no, it is fast growing. It is increasing very fast. Then it could be hematoma or any malignant lesions. What I mean to show here is how does this particular history will help you in diagnosing this particular condition. You are getting me, everyone? I have given you 3 example here. Accordingly, all these 3 things will give you a different diagnosis. Fine. What is the progression and recurrence of this swelling? Now coming to the next thing, what are the different complaints you can face in dental patients? Number one, as I've told, pain, which is the most common complaint when it comes to dental patient. Most of the patient, they come to you with pain. Now it could be dental pain, TMJ pain, or any other pain. Okay. The next complaint could be swelling. It could be swelling of the gums. It could be swelling of the cheek. okay, or any other area. The next complaint could be bleeding gums. Patient might complain of bleeding gums. This is again a very common complaint. Loose teeth, as I've told you, the patient may complain of loose teeth. So according to the age of the patient, you can give a diagnosis accordingly. Missing teeth. Now, when patient comes to you with missing teeth, you cannot write a complaint as missing teeth. For example, Ali Kabi comes to me and tells me, Doctor, I have missing teeth. Please replace it. Shall I write it as a missing teeth as a chief complaint, or what should I ask him? Anyone? Why lost is missing? Why is it missing? No, you cannot ask it as why is it missing. You can ask either why you want to replace it. You're getting me? Instead of asking why it is missing, you ask him why you want to replace it. Then Ali Kabe will tell me, no, doctor, I cannot eat laham without teeth. It is difficult to eat laham. Then you can write the patient chief complaint as patient complains of difficulty in chewing food because of loss of tooth. You're getting me? Then in the history, Ali, you can ask him how did he lost his tooth. In the history, you can ask him, how did you lost your tooth? Was it a trauma or you got it extracted or other things? That will come in history of present illness. But in the chief complaint, you better ask him why he want to replace. He will tell, no, doctor, I have problem with chewing food, so I want to replace it. Then you can write patient has difficulty in chewing food because of loss of tooth. Hope I am clear to everyone. Okay. Now, the next, maybe the patient comes with you with irregular teeth. What is the meaning of this? Irregular teeth. What is the meaning? Irregular teeth. Improper. Okay. Not in specific place. Very good. Both are correct. So basically, the patient complains of irregularly placed teeth. So he wants to correct it. Right? This problem is basically from childhood. And these patients will usually go for takveem or ortho treatments. So your history of present illness will again have questions depending on this particular problem. Okay, this is the end of your part 1. Remember, the most important part in this lecture was your chief complaint and history of present illness. You should know how to write a chief complaint, the patient's own word. And as I have told you, it's not exactly what the patient says. You have to write some logical sentence. And in history of present illness, try to write the history of that complaint so that which can help you in diagnosis. Is it clear for everyone? Inshallah, in the next week practical sessions, you will be given different scenario, like patient with swelling, patient with bleeding gums, patient with mobile tooth, and you are supposed to write the chief complaint for that patient, and you are supposed to write the history of present illness for that patient. Will you be able to do that? I'm asking everyone. Is it clear now? Can you write a chief complaint and history of present illness for any scenario which is given to you? Will you be able to write it? Okay, one guy says yes. What about others?